Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about on the ovarian cancer, and we are just going to talk about its important risk and preventive strategies as well. Yes, for this discussion now I welcome our expertise none other Dr. Sudha Sinhaji, who is our clinical HOD director, senior consultant medical and hemato-oncology from Yashoda Hospital's Somajigoda unit. I welcome you, ma'am. We all are very privileged to have you with us today.
Thank you very much for having me. So, thank you, Shanti, for doing this program on ovarian cancer risks and prevention. I think it's very timely. We are hearing a lot about ovarian cancer nowadays.
Yes.
And it's also that it's not very easy to detect. Symptoms are not easy to catch. So it's a cancer that has a lot of its own challenges. So
Yes,
I
ma'am.
think being aware of this issue and knowing when to suspect it, what kind of tests that need to be done to detect it. It's going to be very useful for everybody who's attending this webinar. So thank you for doing this topic, and I hope everyone will find it useful.
Yes, ma'am. Of course, yes, ma'am. Yes. Now I welcome all our speakers and please introduce yourself. Yes. Over to you, Jai Sudhaji.
Myself, Dr. Jayasudha, who had an experience of 31 years in nursing education and service. I had work experience at Apollo Hyderabad. Now at present, I'm working in DMCH College of Nursing, Ludhiana. Thank you for invitation, Ms. Shanti.
Yes. Yeah, great. I am privileged as well to have you with us today. Yes. Over to you, Jyoti.
Yeah, good afternoon, everyone. Thank you for the opportunity to have a participation and get the insights on ovarian cancer with everyone. I thank my principal, Professor Gina Cherian, ma'am, who has given me opportunity to be a part of this wonderful session. I am Professor Jyoti Lakshmi Chetty, and I have 15 plus years of experience. And right now, I'm the head of Department of Mental Health Nursing in Yashoda College of Nursing, Gaudavalli. Thank you.
Yes. Yeah. And over to you, Veronica. Yes.
Yes. Good afternoon, everyone. My name is Veronica. I completed my MSc Nursing and I'm working as an assistant professor in RVM College of Nursing. And my sincere thanks to Shanti ma'am for giving this opportunity. Over to you, ma'am.
Yes. Thank you. That was very wonderful introduction we heard from everybody. Yes. Now going with the prevalence. Yes. Always we like to understand what is happening with the disease. Yes. In the overall scenario. Yes, ma'am. Over to you for your great insight. Is ovarian cancer prevalence decreasing, and are there signs of progress in reducing this disease condition, ma'am? Over to you, ma'am.
So I think it's neither increasing or decreasing, but we are seeing a lot more ovarian cancer because of the awareness of it. More women are seeking care. They want to know what is wrong with them. And we have so many more good treatment options for ovarian cancer that we are seeing women live longer with ovarian cancer. So in a way, it might feel that we are seeing a lot of ovarian cancer around us. Definitely compared to 30 years ago and now, we are detecting better. We have got better at detecting them. We've got better at doing better surgeries. Our treatments have improved. So the prevalence that way has increased of ovarian cancer because of a lot of different things.
Very right insight you have provided, ma'am. Yes. Over to you, Jai Sudhaji. Let us see what we have in the session. Yes. Over to you.
Ma'am, beautifully explained about the prevalence of ovarian cancer. But usually, when women say cancer, means everybody thinks about breast cancer and cervical cancer. And ovarian cancer, as many of them are not aware of it. Could you please explain a bit about what is ovarian cancer?
Yeah, I agree with you completely. When we think, we remember cervix and breast, sometimes uterus, but we hardly remember our ovaries. And I think it's a very important organ for all of us to keep in mind. So ovarian cancer is a very broad term actually, and there are different types of cancers that can happen in the ovary based on where the cancer is starting from. The most common one that we see is what we call an epithelial ovarian cancer, where it is arising from actually, like you've written here, the cells of the ovary. So not just from the ovary, this type of cancer can start from the fallopian tube also. It can start from the peritoneum, the covering also, and from there spread to other organs. So the treatment, whether it starts from the ovary, the fallopian tube, or the peritoneum, the treatment, the way we approach the problem is the same. And so all these together are referred to as ovarian cancer.
Yes. Yes. Over to you, Jyoti.
Thank you so much, ma'am, for your wide insight. As you have told very correctly, that it's a very broad cancer, and at a nutshell, people understand that ovarian cancer can just focally, it can affect any one part. And as we know that different parts are involved in ovarian cancer. So, what will be the right age? Mostly people think that after menopause it happens, but what is the right age, ma'am? Where does the risk starts? We would like to.
You mean to say what age? I mean, yeah,
Yes,
because
ma'am.
this is also, the content which we were going through. It says that after 50, but we only can understand by ma'am because madam, takes a lot of the clients. Yes, ma'am. Over to you.
Yeah. So the same, little bit like what I said before, when we say ovarian cancer, we have different types of cancers in the ovary. One is called a germ cell tumor in the ovary that we see. Then we have something called sex stromal tumors. Then we have epithelial ovarian cancers and some rare tumors also.
Yes.
So in the younger age group, especially between the ages of 18 to 25, what we see is these germ cell tumors of the ovary, which are cancers, very highly curable with chemotherapy and surgery. So we should not think in our mind that ovarian cancer is something that happens only in older people. Some
Yes.
tumors of the ovary can happen in younger people also. So if
Yes.
we are able to catch them in the younger people also at an early stage, we can still have good treatments that will cure the cancer, also help the woman go ahead and lead a normal life with normal children, with fertility preservation and all that. So
Yes.
yes, that risk increases with age. The common type of epithelial ovarian cancer we see, older you get, higher the risk is. So we see
The
it
risk
more in
is
menopausal women is what we see. After the age of 50 is when we see epithelial ovarian cancers. But I would like to say that we should remember even younger women can get a different type of ovarian cancer, which is highly curable. So if there are any issues, we should reach out, and we should not be limited in our mind by thinking, I am young, I will not get a cancer.
yes, yes, yes. Yeah, that is a very great insight and very productive on clearing myth versus fact. Yes. Yeah, over to you, Veronica.
Ma'am, I would ask about which specific pelvic and abdominal pains should raise concern for ovarian cancer, because all women they are getting abdominal pain before and during the menstrual cycle. And what are the risk for ovarian cancer, ma'am? Ma'am, could you please explain in detail?
So yeah, the symptoms of ovarian cancer are very, very difficult. So usually women come to us with complaining of something not right in the abdomen. They're feeling bloating. They eat even a little bit and they're feeling very full. Sometimes they're feeling heaviness in the abdomen. They feel they're having a lot of acidity. Many times they can't explain also what is going on, but they feel that something is not right with their body. So when you have so vague symptoms like that, it is very difficult for us to tell whether, for me to tell, yes, you have ovarian cancer. So like if you have a breast cancer, we usually tell our patients, everybody, that if you feel a lump in the breast, go to the doctor immediately. So what can we say like that for ovarian cancer? Because the symptoms are so vague, we cannot say something like that. But what we should remember as people is that anything that is there in the body usually gets better, right? You have acidity, you go, you eat a biryani, it will get better after 1 or 2 days. But if you're having acidity every day for 2 3 weeks, then something is not right. If you're having cramps during your period, after your period, and you're getting better, that is one thing. But if
Yeah.
the cramps are so bad that have to take off from work every time you have a period, then there is some problem that is there, which is more than usual.
Yes.
So symptoms that are not getting better, even with the regular treatment, you're taking one pantoprazole, not improving, you're improving your diet, not getting better. Anything you will see for 10 days, 2 weeks, things are not getting fine, then you should go and see the doctor. It takes very little test for us to see whether that problem is there or not. So from a patient point of view, seeking doctor's help. From a doctor point of view, keeping this cancer in my mind and doing a
Yes.
test to see whether it is there or not. Both are
Yes.
equally important.
Yes. Yes, very great insight for the same. And going forward, ma'am, I heard you talking in one of the channel about BRCA1 and BRCA2. Like, yes, nurses also, they should also know because a lot of advancement is happening in the preventive oncology. Yes. So what is this human gene BRCA1 and does it impact ovarian cancer? And my second insight would be from your end is, does this family genetic counseling helps, madam? Because you see a lot of cases and it is only you can throw a lot of insight on the same. Over to you, ma'am.
First, thank you for watching my videos, Shanti. That's
Thank you.
really nice of you
Thank
to
you,
do
ma'am.
that. Second is what we are learning with time is a question that patients have and families have asked forever. Why did I get it? Why was I chosen for this
Yes,
cancer?
yes,
Right? And we have learned that in some patients, we see some mutations. So some change in the gene, which is
yes,
responsible for giving them an increased risk of ovarian
yes,
cancer. So
yes,
everybody is at risk as they're growing old. But if you have these mutations, then your risk is higher than that of the general population. So in a general population, if we say that 2 out of 100 women will get ovarian cancer, if you have a mutation like a BRCA1 or a BRCA2, here we are saying that maybe 60 women out of 100 will get an ovarian cancer. So your risk increases tremendously when you
yes,
have these mutations. There are
yes,
many mutations that we have learned can cause ovarian cancer. The
yes.
most common ones are the BRCA1 and the BRCA2
Rakato.
mutations.
Yes,
Not everybody that I test will have the BRCA1 and BRCA2
yes,
mutation.
yes,
Probably around 10% of my patients will have these mutations. Around 10% of the patients will have family history of a breast cancer or an
yes,
ovarian cancer in the family. So
yes,
knowing the family history is very important. And
yes,
sometimes, people will come and tell me that I have a family history, so am I at risk? That information is not enough. What for me
yes,
as a doctor is important is what is the family history that you had? Did your mother have it, father have it, uncle have it? What age did they have the cancer and what cancer did they have? Only if we know that information, we will be able
yes,
to guess whether there is a mutation, should I send it for testing or not.
yeah,
So
yeah,
being a little more aware about not just saying family history, but who had the cancer, at what age they had the cancer, and hopefully what type of cancer they had. This is an information which for me, if I get as a doctor, I will be able to tell whether it is
yes,
an
ma'am.
important family
Yes,
history or not.
yes, yeah. To yield the better outcome of yeah, whatever the as for the severity. Yes, going forward, yes. Yes, Jesudha.
Yes, ma'am. Beautifully, you have explained with your experience what the people should do. Always we talk about the early detection is for the prevention. So, what is your experience about that? How early we can detect this cancer, ma'am?
So the best way to detect ovarian cancer early is to reach out to a doctor early. So like we
Yes,
have in breast cancers, mammograms, in cervix cancer, we have pap smears. Like that, we don't have anything in ovarian cancer. We don't have a single test we can do and say you're at risk for getting this cancer, so get surgery done. Like that, it is not there. So in fact, the CA125 levels that you have written here, we don't
yes,
ask them anybody to get it done routinely. So
yes,
CA125 can be elevated even in younger women who have endometriosis. They can have an elevated CA125. In some benign tumors, they can have an elevation in the CA125. Of course, if you are menopausal and you have a CA125 level that is 3000, I am more worried. But if you are premenopausal and you have a CA125 level of 60, maybe I'm not too worried about it. So
yes,
CA125 is a tumor marker. It has to be used very carefully. We don't use it for diagnosis of cancer. We use
yes,
it once a patient is diagnosed with cancer, we use it to follow for treatment. Are they
yes,
responding to the treatment or not? At that point, we use the CA125 levels. Sometimes we use it as a test to see whether there is what is the risk of this person getting not risk, but what is the chance that the tumor that I'm seeing in the ovary is a cancer or not. But that is not
yes,
the perfect way of doing the CA125
yes,
test. So
yes,
more than regular health checkups because the symptoms are vague. If you have a symptom that is not getting better, going to the doctor and getting an ultrasound done, that might be one of the ways that we can detect ovarian cancer at an early stage. We don't do biopsies routinely for ovarian cancer. If somebody has a tumor in the ovary, say there is a large tumor in the ovary, this is one place where we don't do biopsy if we think it is stage 1. There we take the patient directly for surgery, because once I put a needle into the ovary, if it is a stage 1, it becomes a stage 1C. So it becomes a higher stage once I put a needle there. So if I think that a tumor is there only in the ovary, we generally never do biopsies. If needed, we take the person for surgery.
Can the
Yes,
pap
that was-
test helps to detect the ovarian cancer, ma'am? Because
No.
that's certain myths.
No.
Pap smear is for cervix cancer.
Cervical,
So
yes,
cervix
yes.
is something that is there outside. It is the lower part of the uterus. So technically it is very far away from the ovary. So
Ovaries,
pap
yes.
smear will help us to detect cervix cancers early and pre-malignant cervix conditions, but nothing to do with ovarian cancer.
Yes, yes. Yeah, that is, I think this topic is very too vague, and we're just developing a lot of interest as you're providing your insight. Yes. Over to you, Jyoti, for your query. Yes.
Yeah. Ma'am, actually for ovarian cancers, we have seen there are different kind of treatments available. And as you said, ovarian cancer doesn't happen in a particular part, it happens in different sites for different people. So please give us a insight upon the different kind of surgery options available. And even I would like to ask, ma'am, cytoreduction we are hearing, it is mostly for abdominal surgeries we have seen. However, it is very good and practically helpful, ma'am, for ovarian cancer. What is the success rate after the cytoreduction also?
Yeah. So the main treatment to cure ovarian cancer is surgery. No amount of chemotherapy, immunotherapy, targeted therapy that I will give will be helpful if a surgery has been done in a bad way. So we have to remember that the main treatment for ovarian cancer, if we want to cure ovarian cancer, surgery is the treatment. There are some steps that we do for ovarian cancer surgery, and that all those steps included are called cytoreductive surgeries. So not everybody should be doing the surgery. When we go to seek help, we should go to a surgical oncologist, somebody who is specialized in doing surgery for ovarian cancer. And it is very, very important that every step of that ovarian cancer surgery, where we are removing the tumor from the ovary, we are removing the uterus if necessary, we are looking at the lymph nodes, the omentum, we are checking the entire abdomen, we are taking the fluid out. So this is a very strict protocol that we have to follow if we want to cure our patients with ovarian cancer.
Ma'am, could you please highlight regarding targeted therapy?
Yeah. So once we do surgery for patients, so we give chemotherapy also to improve the cure rates. And sometimes we give a little bit of chemotherapy first, then do surgery, and then some more chemotherapy. Now, for patients who have BRCA1 and 2 mutations, and for some patients, when we test the sample, we have something called HRD. So patients who are HRD positive, these patients, they benefit tremendously from a drug called PARP inhibitor, and that is a targeted therapy. So PARP inhibitors, there are different types. The most common one we use is olaparib, and these are tablets. After surgery and after chemotherapy is over, we put patients on these PARP inhibitors for 2 years to prevent the cancer from coming back, like a maintenance treatment. And we use that only for certain patients who have those targets of BRCA1, BRCA2, and HRD. And there we are seeing cure rates improve a lot.
You mean to say HRT is Herceptin, ma'am? If at all.
No, that is HER2. That is a
HER2,
different.
yes.
HRD is a different homologous recombination deficiency. That's what it's called.
Yeah,
But it is a bunch of tests that we do on the ovarian cancer, and we give a score, and that will tell us whether this targeted therapy will work or not.
Yes. And as Jayasudha ji asked about targeted therapy, like do we only aim to target while doing the chemotherapy or
So targeted therapy is different from chemotherapy. In that
yes,
chemotherapy, we are giving, it will, any cell that is dividing fast, it will attack that cell.
yes,
Right?
yes,
Targeted therapy is where we are trying to find out what is causing the cancer in this patient,
yes, to
and
trigger.
then giving a treatment that will block the pathways of that. So
Yes,
there, the PARP inhibitors in ovarian cancer, we have found some pathways which are very important in ovarian cancer.
yes,
And when we use the PARP inhibitors, we are targeting those pathways and we are improving the cure rates.
yes. Yeah,
Ma'am,
thank you, ma'am. And I think we keep hearing a lot of the time precision-based targeted therapy, all this. So great that you have provided your clear insight on the same. Yes, Yashoda, you wanted to say something?
because always we feel that prevention is better than cure. So,
Yeah.
is it ovarian cancer is preventable?
That's a difficult question. I unlikely that, I think a lot of it has to do with the mutations that we have. A lot of
Yes,
it has to be do with what fate has written for us.
yes, yes,
But yes, in some there are some very few risk factors for ovarian cancer, and anywhere for any cancers, having a good exercise routine, having a good diet, and maintaining a healthy body weight is very important.
very
So
important.
in an exercise routine, not going for short walks, but where you're pushing your heart a little bit, and where you're doing a proper cardiac exercise, you're doing strength training, that is very important for us. It's not fashionable, it is necessary. We have
Yes,
to, all of us have to do that cardiac and strength training, because we think when we lift weights, it's a man's thing. They're going to the gym and everybody's trying to act posh.
yes,
No, for the
yes,
60-year-old, it's most important to lift weights and do things like that. It reduces the risk of not ovarian cancer just, but also endometrial cancer, breast cancer. And diet, when we say within reason, we should have a proper diet. Yes, you have a nice picture there.
yes,
So having a diet which is high in vegetables, so 3 cups of vegetables a day. Even vegetarians in our country don't eat 3 cups of vegetables every day. So
yes,
making sure you have
yes,
a lot of vegetables in your diet, a lot of fruits in your diet, eating at
yes,
least 2 fruits a day. So, and then trying to decrease the amount of processed foods that we
yes,
have. So having more millets in the diet, not that you should never eat rice, but making sure that at least one time in the day, we are having some kind of an unprocessed food when we are doing our dosas, when we have one dinner. So at least 2 meals in a day, we are having unprocessed food. 1 meal a day, we can do whatever we want to do. So vegetables, fruits, and processed food, avoiding processed food is most important, especially for ovarian cancer, because we don't have any screening or prevention mechanisms
yes,
that are there.
yes,
So I think living a healthy lifestyle is very important.
yes. And yes, that was, we have come to the end of the session, and very greatly, I must appreciate you for your valuable time, and ma'am, that you have provided very great insight. And I urge all the viewers to just refer www.yashodahospitals.com for more insight, more podcast, more infographics, and patient testimonials, including doctor's health talk. Because unless you see, you hear, we do not stay updated. Yes, thank you so much. And healthy woman, healthy nation is a quote which we just very recently we celebrated a Women's Day. And yes, we wish all the women safer health. Thank you, all the speakers, for your valuable time. Thank you, Sudha ma'am, for your time as well. And we end the session. Yes.
Thank you all.
Thank you, ma'am.
Thank you. Thank you, Dr.
Thank you, ma'am.
Jayasudha. Thank you, Veronica. Thank you, Professor Jyoti. And thank you, Shanti, for having me today.
Thank
Thank
you,
you
ma'am.
Thank
very
you.
much.
Thank you.
So
Thank
Thank you, ma'am.
thank you so
Thank you
much
so
for having
much.
us.
Bye.